You're now on. And Ms. Patricia Mayberry, welcome to our office. And we just wanted to have a few words with you today about your experiences in our office.
Mm-hmm.
Let us know how long you've been coming to the office.
Oh, I've been coming here for 20 years or more, and I've taught Dr. Gutierrez's children, and I know him well, and I've had very good experiences here.
And with your treatment, what was your experience like when you first were told that you had to have implants done?
Well, I was very much afraid and anxious, and I wasn't so sure. I wanted it done, and I told my husband, I think I'm just going to leave them. You know, I'm getting older. I don't need them. But I was so surprised when it happened, because they gave me this little pill, and I came in and I was tired, and I think I slept through the whole thing. I remember hearing a few words during it, but I don't remember anything. I had no pain at all. I couldn't believe it. I think and I went home with teeth that day, and I think the hardest part was learning to put the teeth in and out, and that was a little problem at first, but it all worked out. It didn't take long at all.
And how do you feel afterwards? Are you happy that you had it done?
Oh, I'm very happy I had it done. My husband says I smile a lot more.
Great. And if you could say the one thing that was the most impressive part of the whole experience that you had, what would that be?
Dr. Gutierrez is so gentle that it was a very good experience, very good, and I would do it again.
Good.
And I recommend for anyone that needs them to go ahead and have an implant.
Great. Thank you so much. Hello, Frank. We've asked you to come in today to talk to us about your experience with your implants in our office, and we'd like to hear a little bit about what your expectations were coming into the office and how the whole procedure went.
Okay, the expectations I had was I was trying to eliminate the possibility of having a lower plate put in. I had to have like 7 teeth removed, and I would have to get an entire plate.
Mm-hmm.
And I've been told over a period of time that putting a plate in the bottom with no suction is a very sloppy, messy way to have a plate in your mouth, so I entertain the implants. I always had some trepidations about implants, only because I wasn't sure how they operated. And the doctor showed me, different things in my bone structure and so forth, and how it would work. And I said, fine, let's give it a try. The only other thing I had was about I'm very prone to grinding my teeth at night when I sleep. And that was one concern I had, but that was eliminated by taking them out at night, so that wasn't a problem any longer. And it's made a huge difference, because I have a plate in the upper at the present time, and I favor the bottom now, because if I want to eat corn or something that's chewy, I'm using the bottom with the implants as opposed to the whole mouth. So I'm going to do the upper very shortly, pretty soon, because I've had problems with the plate getting loose on me, because I'm up and down with my weight all the time. And that has been eliminated with doing the implants.
In your procedure, as it was done, were there any complications? Did you have any problems?
No, I had no trepidations about that whatsoever, because I had, at the time it was done, we had 7 or 8 teeth, I can't recall how many, taken out at that time, and the implants done at the same time. And it was done, I believe, on a Thursday, and the office is closed on Friday. Doctor called me on Friday. He said, why don't you come in and we'll double check it. I said, no, everything is okay so far, so you can stay home. And then came Saturday, he called me again. He says, you sure you don't want to come to the office? I'll meet you at the office. I said, not a problem. I'll see you next week on my regular scheduled time. And I didn't have a problem. And as far as pain goes, I didn't even use the pain pills he gave me. I used a couple of aspirins, or a couple of Tylenols, if you will, and took care of the problem. I didn't have a big problem whatsoever. It was a lot easier than I thought it would be, you know.
And if someone were to ask you if implants would be the way to go, what would you tell
Oh,
them?
absolutely, absolutely true. That's the best way to go. I have no problem with the bottoms at all whatsoever.
Okay. All right. Thank you very
That's
much.
good. Okay.